Hi, October is the month where the Spina Bifida Day is celebrated. Or in the sense, it's not exactly celebrated. It is, the day has been fashioned or the day has been decided, Spina Bifida Day, to improve the awareness about Spina Bifida in the community. So today we will discuss briefly about Spina Bifida and then how to manage or what are the urological problems, urinary problems in children with Spina Bifida. Spina Bifida is a congenital malformation, or you can call it a manufacturing defect of the spinal cord. What happens in Spina Bifida is the spinal cord, when the baby is in the womb, in the early days of formation of the embryo, the spinal cord is being formed, and that process undergoes a manufacturing defect very early. So there are mainly two types of Spina Bifida or spinal malformations. One is a Spina Bifida which is open to the outside. For example, the baby will maybe born with a mass or a lump on the back, or the spinal cord may be just opening outside and leaking the fluid. This is one type. The other type is called Spina Bifida occulta, where the skin is covered normally on the back. Inside, there is a problem with the spinal cord. So these children can have some external signs like abnormal hair on the skin at that point where the Spina Bifida is inside, or they can have a reddish, what we call as a hemangioma patch on the skin in that very area. So this is how we can diagnose or suspect these conditions. Now, the most important point to remember is majority of these spinal bifida malformations are preventable. The best way to prevent is to ensure that there is no folic acid deficiency in the mother before she gets pregnant. So before the mother plans pregnancy itself, it is important to ensure that the mother or the expectant mother or the future mother is not suffering from folic acid deficiency. So one way to ensure this is all women who are of childbearing age to give folic acid. That is one way of doing it. The other way of doing it is at least those who are planning a pregnancy, they start taking folic acid at least a few months before planning the pregnancy. Now, once the pregnancy occurs and by the time the pregnancy is confirmed by the test, already this malformation has occurred inside. If at all that baby is going to have it, this process is over. So there is no point in taking folic acid after the pregnancy is confirmed. So it should be taken before the pregnancy is actually planned. So that is probably the most important message that I want to convey to all the women of childbearing age, whoever is planning for pregnancy. Please ask your doctor how to prevent Spina Bifida malformation in the baby. Then coming to what is the treatment. Suppose the Spina Bifida is not prevented, the baby has Spina Bifida and the baby is born. Of course, many times the major malformations we are able to diagnose before birth. So if it is diagnosed very early, say by 20 weeks in the TIFA scan, then sometimes we discuss with the parents as to what is going to happen, what are the various issues, and then let them decide what to do. The problems with Spina Bifida is once the baby is born, the baby may have neurological deficit. So neurological deficit is of two types rather. One is depending on which part of the spinal cord. Commonest is the lumbosacral, that is the lower part of the spinal cord. So once it is affected, the nerves that give strength to the muscles of the lower limbs and the nerves that give strength to the muscles that control the urination and defecation or motion are affected. So what happens in these babies is some of these babies will have weakness of the legs or lower limbs. The weakness may range from mild weakness to very severe weakness or even paralysis of both the lower limbs. And some of these children may have an inability to control the urination or the stool. So they may not have the sensation of urination, they may not have the sensation of the stool. Again, this is a very complex subject.